If we talk about the immunoglobulin, they're having different isotypes. But a simple formula, GAM, you can remember as IgG, A, M, D, and E. To start the elaboration, the all isotype can't exist as monomers. It is wrong. The all isotype can exist as monomers. They can exist separately in a one molecule white structure. And there is a matured naïve B cells pure with division express that IgM and IgD on their surfaces. The mature and a naïve B cell pure with division express to IgM and IgD on their surfaces, and they may differentiate to germinal centers, often known by isotype switching and G rearrangement that induced by cytokines in CD40 ligand. The switching are totally the gene rearrangement, and that is going to induce by cytokines in CD40 and into plasma cells. They secrete IgA, G, and A. For B cells, IgM and IgD mature to plasma cell at day H. They are saying for the B cell, IgM and that full mom, and for that mature to plasma cells, and they go for the H's. And what are the H's stand for? IgA, G, and A. It's a very good mnemonic. The moment that IgM and D are giving and maturing the B cells, and that will converting into plasma cells, and these plasma cells are going to secrete IgA, G, and the E. Affinity refers to individual antibody-antigen interactions, while avidity describes the cumulative binding strength of all antibody-antigen interactions in a multivalent molecules. First, we have to talk about the IgG. The IgG is a main antibody in a secondary response to an antigen. It's a more abundant isotype in serums, and it fixes complement opsonization of bacteria, neutralizes bacteriotoxins and viruses. Only isotype that crosses the placenta provides infant with passive immunity that start to wane, but it's very important. It's only one and only exception that pass the placenta. IgG greets the growing fetus. Like IgG is going and say hi to the fetus, like you are in our body. And associated with the warm autoimmune hemolytic anemia, the warm weather is G. When they will be very increase in temperature like that, they will can cause the hemolytic anemia. And therefore again the warm weather is good. And then the IgA. The IgA prevent the attachment of bacteria and virus to the mucous membrane to prevent the destruction of a normal structure and does not fix the complement. The complement are going to fix is by IgG. And there's a monomer in circulation or dimer. They can do monomer, it can be dimers with the chain which when secreted and crosses epithelial cells by transcytosis. They can cross the epithelial cells by transcytosis and produce in GI tract by pyrobatches and protects against gut infections. And most produce antibody overall. It's IgA but has a lower CM concentration. Maximum that antibody are going to produce is IgA, but it's having low CM concentration and release into secretion like tears, saliva, mucus, and pus milk, and picks up security component from epithelial cells which protects the FC region from luminal proteases. And guys, this next is IgM, the mastermind. The first antibody to produce during an immune response is that fixes the complement antigen receptor on the surfaces of the B cell. The monomer on B cell, pentamer with the J chain when secreted. They are going to be normalized so in the pentamers, but they can be monomer on B cell and it is secreted with the genes. Pentamer enables avid binding to antigen while hormonal response involved. It associated with the cold autoimmune hemolytic anemia. The cold autoimmune hemolytic anemia IgM and warm autoimmune hemolytic anemia is associated with IgG. The warm weather is good. Cold weather is mastermind. Is IgM. The IgG is expressed on surface of mature named with the normal low level are detectable in serum. IgE binds mast and basophils Crosslinks, when exposed to allergen and mediating intermediate type 1 hypersensitivity through release of inflammatory mediators such as histamine, and contribute to immunity to parasite by activating the eosinophils. And also it is called the antibody-dependent cytotoxicity, like activation of any cell by reducing an antibody that is eosinophil-reducing IgE. Same like IgG is using by natural killer cells sometime. These antigen type and the thymus independent and thymus dependent. What is happening? The antigen liking a peptide component, while lipopolysaccharide from gram-negative and can't be presented by MSC2 T cell. And with the immunogenic vaccine often require booster and adrenaline, that is the capsular polysaccharide subunits of Streptococcus pneumonia. And sometimes the antigen containing a protein components, and that cause the class switching and immunological memory occur as a result of direct contact of B cell and T helper cells. That is thymus dependent and thymus independent, having the liking peptide components that can go to present by MSC2 class T cells. Fine.